Mohs surgery is a specialized skin cancer procedure where we use a microscope and special techniques to remove skin cancer in its entirety with the number one goal to save as much good skin as possible.
Mohs is unique because it allows us to check the skin edges at the time of surgery. It allows us to precisely remove exactly what tissue is needed and no more. It allows us to examine the tissue in the most thorough way possible, and that way we can get a much higher cure rate than any other modality.
The entire goal is to, of course, number one, the cancer is entirely removed, and the cure rate for Mohs surgery is 98 to 100%. In theory, it's 100%, but machines and humans sometimes affect that, and in practice it's about 98 to 100 depending on the study. The procedure is performed with a standard surgical steel blade, and the specimen itself is removed by normal surgical techniques. What happens to the tissue after that is the difference between a standard excision and Mohs. That tissue is processed by myself to maintain orientation by myself, and then processed into microscope slides. And I review the microscope slides within about 45 minutes to an hour and look for the actual cancer itself. The number one difference between that versus sending something to a normal lab or having a surgeon remove it in the hospital and send it downstairs to the lab is that the tissue is processed differently in Mohs, to where I'm evaluating 100% of the surface that is removed from the patient.
This group gives us a unique ability to give an integrated approach to the patient with skin cancer. The initial evaluation can be done by one of our general dermatologists. The Mohs surgery evaluation and surgery itself can be performed, and then we have the expertise of our plastic surgeons to do many types of difficult repairs that may be necessary.
For a primary skin cancer that is treated first by the Mohs procedure, it's a 98% cure rate, and some studies will show as high as 99 to 100, but the average and accepted number is 98. So a 2% chance over 5 years that the cancer would grow back. This is a surgical procedure. Complications boil down to pretty much bleeding, infection, allergy, and scar. Those are the main four. Skin surgery itself is a clean procedure by definition, because we prep the skin, but bacteria can reside in the hair follicles. As for scarring and or allergic reaction, typically the scar we discuss ahead of time, and the nature of scar remodeling, and then infection and allergy can be to either the numbing medication and or what we have you apply to the wound after the treatment has been performed.